So as we begin to think about long-term, about healthcare in general, the drive now, or the movement now, is really towards an integration of health and behavioral health. So the notion of interprofessional work is becoming more and more important. We're going to see behavioral health professionals in medical offices. We're going to see behavioral health and medical people or health people at the same table talking about sometimes different things, but we're looking at the patient in a totality.
Just like we have a need for cultural competency across different populations, we do have a different culture within our disciplines and across disciplines. And that always have implications how we, as a professionals, coming together for the best treatment of the clients and patients. It is similar to how learning about cultural competency is to be able to be respectful and be able to learn each other's positive aspect of their own profession, but also being aware of our own discipline's limitations and having to be able to put that on the table and say, well, from the medicine's perspective, they have a lot of technical expertise, but maybe the social workers can bring in a lot of sort of interpersonal and more structural issues that are impacting the service delivery, and the nurses have their own sort of practices and expertise that can be brought up onto the table. So instead of competing each other's attention and demand for the recognition of our own discipline, although that would be nice, it's about having a collaborative working relationship that allows us to contribute our best knowledge and best recommendations for the benefit of the client.
Each profession has its own culture. I mean, as a physical therapist, our culture and education and how we greet our clients and the things that we're doing is pretty defined. And then medicine will have a similar, culture of their own. Social work will have a culture of their own. And so every healthcare provider is going to come with their own profession-centric culture. Mm-hmm. And as we get together in an interprofessional team, we have to be sure that we understand the roles and responsibilities and cultures of the team members that we're working with. So not only do we have to be sensitive to the different cultural differences that we experience with our patients, but we also need to be, in order to be effective, be very sensitive to how our professional culture differs from the professional culture of the others on our team. And once we understand our roles and responsibilities, we will be a much, much more effective team working together.
I think about the healthcare team functioning really well. I think about everyone in that team, and I've done several interviews and conducted research with healthcare providers, and it starts with the gatekeeper, the receptionist, and it goes all the way to every member of that healthcare team. So I've been a clinician for many years, and doctors, nurses, therapists can be culturally competent, but if the nursing assistants, the receptionists, if they don't understand and buy in, everyone buys in together, it's not going to filter down to the patient. So it really has to be, I would say, promoted within the institution.
Being aware of differences within your healthcare team in terms of their own cultural beliefs is important, because it also can affect patient care. If you have providers coming on every shift or every day or whatever the rotation is that come with different beliefs, it can change the plan of care. Again, another example, I worked with an Egyptian neonatologist, and he was the only male on the neonatology team at that hospital, and the other two neonatologists were both female. His Egyptian culture was that the man's sort of in charge, and if you saw him with his own wife and family, he made all the decisions. Whereas the two female neonatologists were much more, let's talk to the family and do whatever, feeling right to them and those sorts of things. And there was one case in particular where one of the female neonatologists had talked with a family who had a very sick, very premature baby, and they had decided they were going to let the baby have a peaceful death. And support that baby, and mom was holding that baby and spending quality time with her child. The change of neonatologist rotation came on. The male neonatologist came in, he looked at the baby and he said, this baby should be intubated and on a ventilator. And within 5 minutes, this very nice, we're going to have time together as a family, and yes, we're going to lose our baby and that's horribly sad, became, let's put this baby on a warmer and let's start doing all these things. And baby got taken out of mom's arms and put on the vent and IV lines and all sorts of things. Baby ended up passing away after a couple days anyhow, which probably would have been the same outcome without those interventions. But it's a matter of, where's the culture? And that was his culture as a provider versus the other neonatologist. But it also confuses the parents. It's like, wait a minute, I thought you said. So then they start questioning what the first group of providers told them. And it's like, well, if we had put the baby on the ventilator for 12 hours ago, would it have made a difference? And the answer is probably not. But I think that's a real important discussion to have, especially in places where we rotate providers through a series of shifts in nursing or days if we're talking about physicians, or covering vacation with therapists, those sorts of things, that we all are kind of on the same page with our plan of care for the patient. So that we're giving them the same message, giving them the same quality interventions towards an outcome, and that we all know what the outcome is that we're working towards.
When I think of interprofessional education and collaborative practice, I believe that cultural competency, cultural engagement, cultural humility, being culturally sensitive is absolutely necessary for us to be effective team members in an interprofessional team, and they're also absolutely necessary for us to be effective healthcare providers.
I think we're going by the forces around us, pushed together in ways that we had not been before, where it was go down the hall and see the social worker, or we don't do that here, go see someone else. I think those days are coming to an end, that we're going to have to work together as a interdisciplinary and integrated team to maximize the health benefits.